Hi, it's Dr. Queen from Advanced ENT and Allergy. We want to talk about allergy testing in the office and what to expect and so forth. So it's done typically with very small needles on the skin, usually on the upper arm. Sometimes it can be done on the thighs and so forth, but generally you use the upper arms. In children, occasionally we need to use a little bit of extra space because they're smaller. And they're very small needles. A lot of people get a little afraid when they think about needles, but they're very tiny, small gauge needles. Each one is very not that uncomfortable. But we also do have topical lidocaine cream that we can prescribe that you can put on before you come. Typically, you sort of cake it on the upper arm and wrap it up with saran wrap a couple of hours before you come in. When you come in, we unwrap it, wipe the excess off, and there's a numb patch here. So you'll feel kind of pushing on the skin, but you don't actually feel the needles themselves. That makes it a lot more comfortable. We do it for pretty much all of the children, but adults are also welcome to have Emla cream, which is the lidocaine cream if they like. Usually, for the most part, it's done over several days. It can be done sometimes depending on the insurance company. Occasionally we have to contract the test because of insurance purposes, but usually you want to get enough allergens. People say, well, how many things should you test? And it really depends upon where you live. We live in Hampton Roads, Virginia, which is an extremely allergic area. So typically here we do test for more allergens. When you start these allergy shots, you want them to last for a lifetime. And so in order for that to happen, you need to have enough allergens in the shot to be able to give you that long-term benefit. So we'll usually put it over a couple of days. If we end up doing food testing, that might be some extra time. It's about an hour and 15 minutes or so each day. They can be done back-to-back days, or they can be scheduled, even weeks apart. It doesn't have to necessarily be in a row. Usually we'll have you stop any antihistamines that you may be taking before for a couple of days because that will cause the skin tests to be false negative. There's a few other medications that you might have to hold that we go over those with you when we schedule. If you take beta blockers for heart disease, that is a contraindication to skin testing in the office. It's okay if it's only for blood pressure only, as long as the heart's fine, but that would be a contraindication. And there's a few other things. If you've got severe eczema where there's really no pristine skin to actually test, that can be an issue. And then the backup plan, if we can't do skin testing, is there are ways to test the blood for allergies as well. The only problem with those is that they're not quite as accurate as the skin testing. So we normally would recommend skin testing if we can.